Good day, welcome to Let's Talk Health. I'm Renee Nash from 96.3 WHUR. We are here at Johns Hopkins Medicine. It's a new platform where we're going to be coming your way each and every month talking about health issues, particularly that impact the African American community. And joining me today, I'm certainly excited and honored to have him here in our presence because we're going to be talking specifically today about Minority Health Month and some of the issues, again, as we said, impacting the African American community. Dr. Otis Brawley, he is a Bloomberg Distinguished Professor here at Johns Hopkins Medicine. So thank you so much for joining us today for Let's Talk Health.
Thank you for having me.
When it comes to health disparities, particularly in the African American community, I mean, we have a wide range of issues that we certainly can talk about. From your perspective, though, where do we need to begin when we're having this really candid conversation?
We need to start talking about prevention. A lot of the diseases that affect especially African Americans are actually diseases that can be prevented if we actually start thinking about health. You know, we don't focus on it as much as we should. Starting with smoking. Yes. We should not smoke at all. I'm a cancer doc. A third of all cancers are due to tobacco usage. And by the way, tobacco kills more people from cardiac disease than from cancer. Then we need to start talking about exercise, good diet, and energy management. Probably 25 to 30% of cancers are due to a combination of obesity, too many calories, and not enough exercise.
Are we not getting that message, though? I mean, when it comes to the Black community, this is not new information. Mm-hmm. You know, we've been saying for a long time, listen, stop smoking, exercise, eat right, and yet we're not all doing it. Why not?
Well, unfortunately, something we call the built environment is really hurting us with the last part of that. You know, 40 years ago, people didn't have cars and they walked a lot more. 40 years ago, we didn't have fast food, we didn't have microwaves, we didn't have processed foods, so we ate more fresh fruits and vegetables. We need to consciously start thinking about eating fresh fruits and vegetables, sitting down and consciously eating, whereas today we always eat on the go, eat in the car and that sort of thing. We need to get back to the old ways of doing things, and then a lot of the problems with energy balance will go away, and some of our cancer rates are going to go down.
There's this perception out there that in order to eat right, to eat those healthy foods that you're talking about, it's expensive. When I can go to a fast food place and I can get a burger for 99 cents, I can get an entire meal for $5. And yet there's, again, that perception that if I want to eat those leafy vegetables and those ripe fruit, it's going to cost me far more than that. And then it doesn't always taste as good as a burger. How do we get the Black community to think beyond that?
Yeah, these are all problems. One of the issues that we run into is, you know, bad food with high calories is cheap. That is absolutely true. The inexpensiveness of high-calorie food is a problem, but we really need to start focusing on what are we going to do for the long term. By the way, it's okay to have a hamburger every now and then, but to have a hamburger twice a day, 5 times a week, that's a problem. So we need to start focusing, and people need to focus on this for their kids. You know, we have in the Black community a huge problem with diabetes, hypertension, heart disease, and cancer, and it's all because we're poisoning ourselves with this food addiction.
The reality, Dr. Brawley, is we are dying. We are dying prematurely.
That's right.
I can speak to this from a very personal aspect. I lost my mother. She was only 67. Talked to her one day, came to visit her the next. She was dead on the bathroom floor. Same issue with my dad. Spoke to him one day, the next day, he too passed away in the bathroom on the floor. Both of them from heart disease. Mother 67, dad 55.
Yeah. When we talk about the chronic diseases, heart disease, diabetes, cancer, the causes are all the same. They're all irritated or caused by problems with diet, problems with lack of exercise, as well as the smoking problem. Smoking, as I said, no one should ever smoke, but we all need to start thinking about exercising 4 to 5 times a week for at least 40 to 45 minutes of just moderate exercise. It can be walking. It doesn't have to be running. It doesn't have to be doing something that requires a lot of exertion. Just walk. And then we need to think about 5 to 9 servings of fruits and vegetables per day. That's a good way of starting to think about it. If you try to focus on 5 to 9 servings of fruits and vegetables per day, that will start crowding out the bad things. Yeah. When we talk about meat, we eat serving sizes that are too big. Mm-hmm. I know this is difficult. I struggle with it myself. Yeah. But we need to start focusing on prevention. We need to start talking about going to the doctor, especially when we're in our 50s and 60s. Those of us who have hypertension need to be treated for that hypertension. Lower the blood pressure, relieve some of the strains on the heart. Yeah. I'm getting into cardiac disease now, but again, a large number of the problems in cancer are the problems in the other chronic diseases, cardiovascular disease, stroke, and diabetes.
Where do we begin, though, doctor? Because, again, everything is about taking that initial first step. And for many of us, it's hard. And I'll be honest with you, weight has been an issue for me for a long time. I honestly can say that I think I got it. I think for me, a lot of times for a lot of people, you have to have that light bulb moment. So I sit here with you because I had a cardiac issue just a couple of weeks ago. And my doctor had to say to me, listen, you've got to change the narrative. Mm-hmm. Before we get to that point in our life where we have that aha moment, where some doctor is telling you this, how do we begin the narrative today? What do we need to do?
You know, some of the things that we're trying to do, and in Hopkins medicine, it's people in our School of Public Health, School of Nursing, School of Medicine. We're trying to get into the neighborhood. We need to get into the grade school curriculums. We need to start talking to people in 1st and 2nd grade about what healthy habits are. We need to talk about exercise. We need to not just give someone a basketball and say, go throw it at the hoop. They need to learn something about aerobic exercise, something about strength training and weightlifting, and how to do it appropriately. They need to develop lifelong habits that are healthy habits or habits to promote health. And those are some of the things that we want to try to do. Now, for those of us who are in adulthood and set in our ways, we need to start learning how to eat. We need to learn how to exercise and also focus on those things. Unfortunately, there's so many things going on in our lives, politically, economically, and otherwise, we sometimes just do not focus on health and being healthy.
And it is about going to see the doctor. You said that earlier. Mm-hmm. A lot of times we have a hard time doing that. We end up in the emergency room when perhaps if we would take advantage of those annual visits. How do you get that message out?
Well, even in medicine, American medicine has been too focused on making the diagnosis and treating. And what we're trying to do is change American medicine such that we're focusing more on prevention of disease and promotion of health. You know, it's a mindset that all of us need to get into. And we as physicians can't talk down to the population. We have had a problem with it as well.
Yeah. So if that person that's sitting out there watching us now is saying, I want to make the change, again, it's about small changes over a period of time versus saying, okay, I'm going to start today, I'm going to work out every day for an hour a day. And a lot of people, they start off thinking that they can do that, and then they get disappointed.
You know, one of the problems over the last 50 years, we've gotten into this problem with energy balance in the United States because our ways of life have changed. I'm old enough to remember in the 1950s and 60s, every family wanted a car. Now many families have 2 or 3 cars.
Right.
In the 1950s and 60s, you would go to the grocery store every 2 or 3 days and buy fresh fruits and fresh vegetables and bring them back and put them into your refrigerator and cook them, and you would sit down and eat them at a table. Today, we are going to the grocery store in our cars, packing up our trunks on a Saturday morning with these processed foods. We don't eat as many fruits and vegetables and fresh meats as we did in the past. We now have processed foods. And we come and we cook them on the go in our microwaves at home. And when we don't do that, we go to these fast food restaurants. I'm not that old, but let me tell you, when I was born, there were less than 50 McDonald's restaurants in the entire world. Now there's probably 50 within 10 miles of the studio. And by the way, most people don't realize when I graduated from medical school, that's when Wendy's invented the drive-through, so we don't even have to expend the energy to get out of the car and walk into the restaurant to get that high-calorie food anymore. So we need to get back to some of the old ways of doing things. We need to get it as a regular part of our life that we do healthy things, we exercise and we eat. And as I said earlier, people don't need to go to the gym and run on a treadmill and do vigorous exercise. We need to walk for 40 minutes every day, 5 to 6 times a week. We need to think about eating 5 to 9 servings of fruits and vegetables. 1 serving of a fruit is a medium-sized apple. A serving of vegetables might be 3/4 of a cup of broccoli. We need to start thinking about 5 to 9 servings of fruits and vegetables per day, decreasing the amount of meat that we're eating, especially red meat. By the way, pork, beef, lamb, those are red meats. We need to try to think about 3 servings of those per week. And a serving size, we need to think about smaller portion sizes. We need to, when we go to meats, we need to talk about fish and chicken, more so. And
and not fry it.
And not fried. Thank you so
much.
much.
Not fry it.
Yeah. We prefer things be baked. Grilling is okay, but you know, that char in the grill that we frequently like has some carcinogens in it. So we don't want to grill it too much. Broil it or bake it, boil it. We need to get back to old ways of doing things. One of the things that has most affected me in terms of statistics is in 1970, 5% of our kids were obese. Today, it's well over 20%, and it's getting close to 1 in 4 of our kids are obese. Among black women in the United States, in 1970, less than 20% were obese or overweight. Now we're well over 65% are obese or overweight. So we need to start focusing on those things. I don't want to just keep pushing about obesity, and I do want to recognize that this is a problem that is difficult and many of us struggle with it. We shouldn't be ashamed of the fact that we struggle with it, but we should deal with it.
So talk about how these issues that we're speaking about today, the health disparities in there. How does health disparities impact what we're talking about when we're talking about obesity, when we're talking about heart disease, when we're talking about cancer?
Well, unfortunately, some of the things that have gotten into our culture have led to these things being far worse. When we talk about just this one thing of obesity, the obesity problem is far greater in the black community than it is in the white community, the Hispanic community, or the Asian or Native American communities. Far greater. When we talk about smoking, that's actually one area that's getting better. Our smoking rates are actually starting to get lower than other people's smoking rates. But when we talk about this diet and energy balance and exercise thing, that's where there's a real problem. And then, of course,
explain this to me before we move on. What do you mean energy balance?
Energy balance is when I talk about energy balance, so many people focus on obesity. It's really 3 things. It's how we store it, that's obesity, how much we consume, we eat too many calories, and how we burn it. We don't get enough exercise.
Okay.
Think of it as a three-legged stool. It's too many calories, not enough exercise, and obesity. It's not just obesity.
Okay.
There's some people who are obese who do a lot of exercise and actually end up compensating.
So health disparities, particularly in the Black and brown community. Explain first and foremost for people, what are the health disparities out there?
When I talk about health disparities, I'm talking about the fact that the death rate is higher. Mm-hmm. When I talk about death rate, I look at how many people are dying per 10,000 in the population. And the death rate for blacks from cancer, for example, is about 25 to 30% higher than the white death rate.
Is it, because it seems like much of what we often hear is that, and it's not about pointing a finger of blame, right? But it seems like the onus is on us meaning as individuals, as people. Is all of the onus on us, or are there some other factors that we need to look at that when we're talking about these health issues that are impacting us?
Yeah. I'm a big proponent of self-responsibility. However, I'm also one to admit that the environment that we live in and live under actually causes us to be at increased risk.
Yeah, because we got to talk about the food deserts in certain communities.
Exactly.
Okay.
Exactly. If people had better availability, a food desert is, there are people who live in communities where there are no grocery stores, or the grocery stores have been designed in such a way that the vegetables or the fruits are either not there, or when they are there, they're so old and spoiled that you don't want to eat them. The other part of the environment that helps us to be obese and have other problems with health is we don't have sidewalks, and sometimes when we have sidewalks in the city, it's not safe to walk on them. Then, of course, the availability of very cheap, high-calorie food in these restaurants.
That big soda that you can get, that's like 2 liters, it's 99 cents.
I'm glad you brought that up. I'm glad you brought that up.
That we should not be consuming.
Fructose and corn syrup, sweetened sodas are just filled with calories. Yeah. And one of the, we talked about how things were in the 1950s and 60s when we did not have this big problem with energy balance and obesity. Back then, the average soda was 10 ounces. Then the can went to 12 ounces, and now we have these 40 and 50 ounce things of soda that people drink. So much of the problem is actually consumption in terms of portion size. Soda pop, meat, potatoes, we're eating larger and larger portions. There are even some scientists who looked at the size of plates that we used to use in the 1960s versus what we use nowadays. The plates have gotten larger. And then you go to certain restaurants and they give you amazing portions of food.
Yeah. But then when you put that smaller portion in front of people, they'll look at you like you're crazy.
Yes. Actually, one of the most interesting things I've done is you bring someone from Europe and take them out to dinner here, and they just are amazed at the American portion sizes. This problem that we're talking about is an American problem. It's not a European problem.
I think that we're glutton for punishment in some areas. So, Dr. Brawley, where can people go to learn more about what they need to be doing to live this healthier lifestyle and to adopt many of the principles we've been talking about today?
That's a really important question. There's a lot of folks who go to the web and they go to some websites that I think are irresponsible. Going to the web is fine, but go to good websites. If you want to learn about cancer and diet, the National Cancer Institute website is a wonderful place to get information, and that's at cancer.gov. The American Cancer Society has good information on it having to do with energy balance and cancer prevention, and that's at cancer.org, O-R-G. The American Heart Association and their website has some wonderful information about diet and exercise. By the way, if you go to all three of those websites, you're going to find the information is all the same, because these are the good places where there's agreed upon, this is the scientific principles of medicine we need to be practicing. And one thing is, where we're talking about heart disease, cardiovascular disease and stroke, diabetes, or cancer, the preventions and the health promotions are the exact same things.
Yeah. So again, this is Minority Health Month. What is the 3 key things that you want people to know about their health and how to live our best life and our healthiest life?
Number 1, I want people to not smoke. Number 2, I want people to try to focus on energy balance. Try to get some exercise. It can just be walking. Try to eat 5 to 9 servings of fruits and vegetables per day. Decrease portion size. Try to get to an ideal body weight. And then the other thing, I'd like, if I were czar of health in the United States, I wish everyone could have a relationship with a healthcare provider. It could be a nurse practitioner, a physician assistant, it can be a physician, but I'd like everybody to have a relationship with a healthcare provider, and I'd like that healthcare provider to be a health coach to try to help people live a healthier life. Sometimes that will involve certain screening tests and certain interventions, but frequently I want people to just think about health on a daily basis and do the right things, exercise and eat right.
Because we've got to turn these numbers around. If we adopt the principles that you're talking about, how quickly can we see, and again, we live in a microwave generation. You know, people want to say, oh, okay, well, I've stopped doing all these things, Dr. Brawley, and it's been a couple of weeks. I ought to be down 20 pounds. That's not realistic. Talk about the realism of taking and adopting these healthier lifestyles and what people can expect.
You know, when we talk about black-white disparities, there were no black-white disparities in the 1950s and early 1960s, and it was things that we started doing in the 1950s and 60s that caused the disparities to rear their ugly head in the late 1970s and early 1980s. There's a lead time to cause the disparities. There will be a lead time to get rid of the disparities. If we could get everybody in the black community to adopt these healthy activities, healthy habits over the next 5 to 10 years, it'll probably be 15 to 20 years before we get back down to white death rates. By the way, the disparities between blacks and whites were much higher in the 1990s than they are today. So there is some help. We are actually moving in the right direction. We just need to move faster.
All right. Well, you've heard it here. Again, we've been talking today to Dr. Otis Brawley, Bloomberg Distinguished Professor here at Johns Hopkins Medicine. And this has been Let's Talk Health.